What's up, guys? Hey, Jared Beckstrand here, Doctor of Physical Therapy, Postpartum Specialist, MommyTummyFix.com. And today I wanted to share with you some of my favorite stretches and exercises to alleviate neck and back pain that's common in pregnancy. Let's get into them right now. All right, you guys. Hey, thank you so much for joining me today right here on Tone and Titan. Right out of the gate, first things first, I'm assuming that if you're watching this video that you are in fact pregnant and that you are in fact experiencing some back and or neck pain. And so first things first, I just wanted to say congratulations. What an amazing thing. Honestly, ladies, this pregnant population is probably my personal favorite to work with. As a father of 4, I've helped my wife with all of her pregnancies. As a postpartum and even prenatal fitness specialist and rehab specialist, it's just my favorite population to work with. You ladies are just complete rock stars. I'm glad that you're here, and I hope the things that I share are going to help you to get a little pain relief. As always, if they do, if the things that I share do help you out, be sure to hit that thumbs up button to like this video. Also, if you're new here, if you haven't subscribed yet, there's that red button right down there in the corner. I'd love to see you back more regularly. I'd love to try to help you out more regularly. Be sure to subscribe to our channel by clicking that button right down there. Okay, so let's talk about back and neck pain during pregnancy. There's 2 factors at play that are going to contribute to pain in both of those areas. First things first, surprise, you've got a growing belly. And if we can make it through the full 40-week term, it's going to get larger than probably it's ever been by the end of that. It's physiology, that's just what happens. And so here's your spine. Your spine should have 4 normal curves to it. With pregnancy, you've got a big old weight that's growing out here. And what that does is that tends to pull on our spine and to kind of round it out a little bit more forward this way. So all of a sudden the curve here becomes a little steeper. What we have to do is then compensate for that adjustment by lengthening this out. So typically our shoulders start to round forward a little more. This is back because the belly is forward, and so then the mid-back kind of between the shoulder blades tends to round this way. And then our head, we want to keep in this good posture, so our neck tends to round this way. Basically, the 4 normal curves that are there are just exacerbated. They're just increased by the pregnancy and by the growing baby. So that's factor number 1 that's contributing to your back and neck pain. Factor number 2, and especially as your pregnancy progresses, and especially as you get into that 3rd trimester, your body starts to release more hormones that are going to cause your joints to relax. This is in preparation for childbirth. Unfortunately, it's not like a just focus on your pelvic floor thing. It's all the joints in your body. And so especially those joints that hold your vertebrae together tend to get a little more lax. And so the things that I want to show you are going to stretch those areas that are tight, are going to introduce a little bit of some strengthening in those areas that are weak, and hopefully you start to feel better because of that. Now, one thing that I do have to mention here, make sure you get your doctor or midwife or healthcare professional's clearance before starting this or any exercise program, especially if you've had complications or if you're at a high-risk pregnancy. I don't necessarily want you doing these activities without your doctor's clearance, so make sure you get that first. Okay, that's enough for me. Let's show you a couple of these stretches. I'm going to give you a couple for your neck, for your upper back, and then for your lower back as well. All right, so the first 2 stretches I want to show you are for your neck. Typically, there's 2 muscles that tend to get tight and painful, and those are the ones that I'd like to stretch out. You can get muscle knots in those areas. Let's show you how to stretch those out. So that upper trapezius, basically to stretch the right side out, I'm just going to take my left ear straight over towards my left shoulder, just until I get a comfortable stretch through my neck and maybe, depending on how tight you are, out into that upper shoulder. If you need a little bit more overpressure, what you can do, I'm going my left ear to my left shoulder. With my left hand, I can reach up to the opposite side of my head and just apply a very gentle overpressure to it. You're going to hold that for 20 seconds, and you're going to repeat that 3 times to each side. You'll feel that one on the outside of your neck. To sneak that stretch around to the back a little bit more, I do what we call a smell your armpit stretch, or the technical term would be the LEVATOR SCAPULAE STRETCH. Basically the same setup. I'm going to take my left ear over to my left shoulder, but now with my nose, I just want to rotate my head so that my nose is going down towards my armpit. And so if you just kind of dive right down into this position, that stretch shifts from the outside of your neck more to the back of your neck. And so my nose down towards my left armpit, now with the same side, so now with my left hand, I can reach up to the back of my head and just apply a little gentle overpressure in that direction, nose down toward the armpit. You'd hold that for 20 seconds on the left, and then we would do that same thing on the right. So nose down towards my right armpit, with my right hand, reach up to my head, apply a little overpressure to feel that on the left back side of the neck, 3 times 20 seconds. Those are your neck stretches. Now for your upper back, or kind of the area between your shoulder blades, we call it your thoracic spine, I'm going to be using a chair. You just want a chair that's firm. You want it to have 4 legs, not one that pivots or twists or swivels or anything like that. And then you also want to have a firm back on it, not necessarily one that reclines. So again, the most common problem that happens in your upper back is it starts to round this way. Shoulders start to round forward and everything kind of caves in this direction. What we want to do is get out of that and kind of extend through our upper back. And so in order to do that, what you're going to do is grab this chair with a nice firm back, and then we're just going to extend over it in this direction. Typically, the way that I tell people to do that is with your hands. Place both hands kind of to the side of your head. I don't want you to interlock your fingers and pull on your neck. Both hands just to the side of your head, and then you're going to come back over the back of that chair. Try to pull your elbows apart. Try to get your shoulders kind of back over the back of that chair, just until we get a good, comfortable stretch in the upper back. You're going to hold that for 5 to 10 seconds, and then come out of it in this direction. So again, we're right here, extending over the chair, hold for 5 to 10 seconds, and then come right back out of it. I recommend about 10 times, 5 to 10 second holds, and then you can do that a couple of times a day. Next, let's show you a rotation stretch through your upper back. So I'm going to square up to you here. What I want you to do is sit with good posture, then with both hands reach to one side. So I'm going to go both hands over here to my left side. You can kind of hook your leg with this. So my right hand is hooking my left leg. My left hand can hook the back of the chair right here. And then what I'm going to do is kind of pull with this hand and push with this hand just until I get a little bit of some rotation through my spine in that direction right there, just until it's comfortable. Hold that for about 10 seconds, 5 to 10 seconds, and then we're going to go back the other way. Left hand hooks the outside of my right leg, right hand hooks the back of that chair, and then I'm going to push in this direction right here. Not uncommon to get a few pops out of that one, a few what we call cavitations, just as that pressure in your back is releasing. I only say that because I just popped my back as I did that. And so nice and comfortable in that direction right there. Typically okay up through your 3rd trimester. Just keep in mind that if you do have that belly there, and if it does get in the way or if anything's uncomfortable with it, probably not the best stretch for you, but at least up through the 1st trimesters, that's a good stretch for your upper back. All right, and we'll finish with 3 quick stretches for your lower back. First one is going to be some anterior and posterior pelvic tilts. What I want you to do is lay down on your back with your knees bent, and then really simply you want to try to arch your back up off of the floor or mat or whatever it is you're on. And so we're going to introduce this anterior pelvic tilt with that. So you'll see that my back has cleared the mat right here. And now what I want you to do is rock your hips backwards and flatten your back down into the mat. And so it looks just like this. And so we're going to rock forward, and we're going to rock backward, and we're going to rock forward, and we're going to rock backward. Now, if you are in your 3rd trimester, I don't necessarily recommend that you spend a lot of time on your back. So that being said, you can also do these in a chair. The mechanics are the same. Seated in a chair, you're going to rock your hips forward, try to arch your back away from the back of the chair, and then rock your hips backwards, try to push your back kind of into that backrest on the chair. Typically what I recommend with this is about 3 sets of 10. So forward and back, that counts as 1. You're going to do about 30 repetitions of that one. That's the anterior posterior pelvic tilt. Next, let's try out a cat camel yoga pose. And so you're going to be down on all 4s, knees under hips, hands under shoulders. Now, the thing with this is, especially into that 3rd trimester again, you've got the belly hanging out down here. What I want you to try to do is try to kind of keep that contracted, meaning if it hurts to just let it hang loose, you might try to tighten your abdomen up, try to suck baby back up into kind of your spine and into your lower back. See if that helps. If you can't get into this position comfortably, let's just bag it. It's not the right stretch for you. And so cat camel, what we're going to do is we're down in this pose, and then basically we're just introducing that same anterior and posterior pelvic tilt. So the posterior pelvic tilt gets me this nice big arch through my back. I'm really trying to stretch my entire spine as I'm up in this position. I tuck my chin down into my chest, stretches my neck, stretches my upper back, and then stretches my lower back as I try to tuck my hips underneath myself. I'm going to hold that for about a 3-second count, and then I'm going to come back down the other way. And so now I'm getting into that anterior tilt position. So I want my butt higher than my back, or now my stomach is kind of dropping down towards the mat. My chin comes up and looks forward here. We're just getting extension through the entire spine. So to do that in real time, here's the angry cat part, flexion, and then here's the camel or cow part, extension. Flexion, up, and then extension, out. Again, you're going to hold each position for about a 3-second count is what I typically recommend there. Last exercise is going to be a child's pose. Again, the main problem that I see is too much curve in your back, and so in order to reverse that, too much of that extension curve, we need to go forward into flexion. The child's pose is a great way to do that. Now, if you're in your first 2 trimesters, it's probably okay to sit with your knees pretty close together. I'm seated on my heels, my knees are pretty close together, and then I'm going to reach forward and kind of get into this position. By your 3rd trimester, again, belly's probably in the way a little bit. What I need you to do is just sit wider with your knees, maybe a little wider with your heels to accommodate some room for that belly to kind of sink down into. Alternatively, there's also a way you can do this in a chair. You just sit in the chair, knees a little wider, and then you're going to reach down forward between your knees. Typically, that's a little better tolerated by that 3rd trimester. But to finish this explanation out, I'm seated on my heels, my knees are down, and then I'm just going to reach forward, sit back on my heels, and kind of just let myself fall down towards the mat. I'm trying to round my back out, especially this lower back part. You might even introduce a little bit of that posterior pelvic tilt as you reach forward, just until we get a good stretch through that lower back. What I recommend there is about 20-second holds. So you're going to sit down in that position for about 20 seconds at a time. You're going to repeat that 3 times, and then you can do that a couple of times throughout your day. All right, ladies, so there you have them. I gave you 2 stretches for your neck, 2 stretches for your upper back, 3 stretches for your lower back. My goal is to help you out of the pain and discomfort that you might be experiencing with your pregnancy. Again, I think you ladies are complete all-stars. If there's ever anything that I can do to help you out, please let me know. Leave me a comment down below. I'd love to hear your thoughts. I'd love to hear your experiences with these stretches. Let me know if they helped you out. If they did, hit that thumbs up button down below. Thanks so much for joining me. Hey, thanks again for joining me right here on Tone and Tighten. If you haven't done so already, hit this circle button right down here to subscribe to my channel here on YouTube. Now, if you're looking for core exercises that you can do while you're pregnant and especially after, check out that link right there. That's a good video for you. There's one more video right down there that you might enjoy. Thanks again for watching. We'll see you next time here on Tone and Tighten.